vagus nerve this, vagus nerve that. I constantly hear that everything is the vagus nerve. It's the cause of every problem. It's the solution to every problem. I recently attended a seminar with Dr. Michael Husmillo, and this seminar was on concussions. Concussions, traumatic brain injuries. And of course, a traumatic brain injury can affect all the cranial nerves. What are cranial nerves? Cranial nerves are the nerves that come directly from the brain. And there's 12 of them. And the vagus nerve happens to be number 10. But he seemed to implicate or blame the vagus nerve for everything. Every second sentence had, and this, of course, is because of the vagus nerve. But how is blaming the vagus nerve useful? I feel it's useful in marketing. I feel people like to blame just one thing or to have a simple solution. And wouldn't you know it? He just happens to run a Master the Vagus Nerve course. Now, I've noticed that my book explained the complex causes of pain and the multitude of possible solutions to it. It doesn't sell well compared to something that says, this one thing causes all your problems, and this one simple trick, this one diet, this one type of exercise fixes everything. Now, don't get me wrong, the vagus nerve is an important nerve, and is the main nerve that connects the brain with the parasympathetic nervous system. The parasympathetic nervous system is the part of the autonomic nervous system responsible for rest and digest. And in particular, the vagus nerve will influence digestion, heart rate, and breathing. But blaming it for everything? Why? And how does that help? Now, don't get me wrong, breathing exercises can seem to help manage the autonomic nervous system. You're basically giving it input, but it isn't going to fix a concussion. In fact, in the seminar, his diagnosis, evaluation, and treatment plans were identical to what I pretty much do already. A lot of it is, eye evaluation and eye retraining.
Gaze, Derek, and look to your left. So he's got some nystagmus on lateral gaze there, as you can see, more marked in the left eye than the right, which is the big hint here as to whether there's an underlying right-sided INO looking to the left. But much more obviously, can you look loud to your right? He's got very marked nystagmus in his right eye with a failure of adduction of the left eye.
Balance evaluations and balance training. And I don't implicate the vagus nerve with every second breath. And notice how eye stuff and balance stuff isn't the domain of the vagus nerve. Look, it is hard to simplify things in the body because everything in the body seems to affect everything else in the body. We know, for example, that just being in a doctor's office increases blood pressure. We know mood affects blood pressure and heart rate and even blood test results. We know taking a placebo is sometimes just as effective as taking prescription medication. Looking at you, antidepressants. I could argue, for a concussion example, that a neck injury associated with the head trauma has led to aberrant signals from the neck proprioceptors, which feeds into the parabrachial nucleus of the brain, because there's a direct connection, and which in part, that part of the brain is responsible for anxiety, and also is related and connects to balance centers. And actually the neck proprioceptors also directly connect to the balance centers of the brain, which causes dizziness and unsteadiness. And so we have anxiety, dizziness, and steadiness, all related to the neck. And this can be the cause of upset stomach, breathing, and heart rate changes in those with concussions. So what do you think of my explanation? I feel this simplification, that I just provided is better than vagus nerve does it all, because the neck is often injured and treating the neck does often improve symptoms. But you see what I forgot in my simplification? The brain injury! A concussion is primarily a brain injury, and the brain being injured can explain all the symptoms. You can have multiple issues that feed into each other, and each person's condition can be unique. And sometimes that means treating the neck or the jaw or balance or the eyes, depending on what part of the brain was injured and how someone's recovering. And maybe that involves treatments related to the vagus nerve, if that helps the patient. But saying everything is the vagus nerve and blaming the vagus nerve for absolutely everything, I think, is an oversimplification. Anyways, do I have a lesson here? I'm not sure. I guess it would be to be cautious in oversimplifying things, particularly with the body. And I suppose you should question the usefulness of your simplification. Anyways, have a great day. Cheers.